Hey, my name's Sarah and welcome to Simple OT. Today I will be talking about the Glascow Coma scale. So as a brief overview, the Glascow Coma scale, or the GCS, is a tool used to measure response or alertness levels in patients. It has 3 sections: eyes, verbal, and motor. The worst you can get is a score of 3, and the best that you can get is a score of 15. I've included Meredith and Derek from Grey's Anatomy as a way to help you connect the GCS level to what you may or may not have heard on medical TV shows, which often is referenced when an EMT rolls up in an ambulance, jumps out with the patient, and they're relaying the info to the doctor in the emergency room, and they're saying patient with GCS level 13 in the field or something like that. This is what they are talking about. So first of all, just to jump into it, you have the eye response section. There are 4 possible points here, 4 being the highest, 1 being the lowest that you can get. If we think of a 4 as you're just spontaneously opening your eyes around the room, looking at things, that seems like a pretty normal response. And then just for dramatic purposes, we're going to say that 1, or the lowest response, is dead. Mind you, it's not dead. 1 could be comatose or just, unconscious, right? But just for simplification, let's say 4 is the best, it's normal, and 1 is the worst, you're dead. Even though we know that's not actually totally true. And then if we assume that, then there's only 2 numbers that we need to differentiate. So if you think of 4 as normal eye movement and then 1 as no eye movement at all, there's a natural progression here. So I think of when you're a kid and you're trying to get somebody to look at you, right? Me trying to get the attention of my siblings, I might first start out by walking in the room. If they don't look at me, 4, I'd move on to 3, which is response to verbal commands. I might say, hey, look at me, hello. And if they still don't look at me, I think I'd get mad. I would feel ignored, and I might jump on to a score of 2 where I start to pinch them just to get them to look at me in response to my painful stimuli. Next, we have the verbal response category. Here, there is a 5-point value. Again, let's think of 5, the best, as normal, and then 1, the worst, as dead, no response at all. Then that leaves us with 3 numbers to differentiate between. And I also see a natural progression here. If we think of a verbal response in line with verbal development or language development, it makes a lot of sense. So first, 1, no verbal response. Think about a baby in utero, they're not talking, just pretend. And then you go on to level 2, it's incomprehensible. Babies, when they're first born and in their first couple of months, they're just, babbling, saying ba 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 ba, just kind of exploring their language. This would be a level 2. It's incomprehensible. It's often nonsensical, and so forth. Moving on to the 3rd verbal response category, it is inappropriate response. So if they score a 3, they have inappropriate verbal responses. So I thought of after a baby is cooing or babbling, they move on to words, and sometimes they're not the right words. For example, if you think of a toddler or an infant, if you go to feed them, they might shout no, even though they do actually want the item. So it's an inappropriate response. It also, if you work with individuals with a brain injury, could be inappropriate responses such as swearing, because As we know, curse words are often retained when the rest of the language is not. And then from there, the baby, infant, toddler, whatever, grows up into a little kid. And if you've been around little kids, you know they ask a lot of questions. They can be confused. This is a score or level 4 here. So if they get a score of 4, that means they are responding to your questions, they're responding to you, but they're often confused. And so a kid or a little kid who's maybe hanging around you might ask a lot of things like what, why, how does that work, and you can see that there's a natural progression from not responding at all to responding incomprehensibly to responding inappropriately, and then responding in a confused but still appropriate state, and then responding as normal. Moving on to the motor response, there are 6-point values here. So 6 being fully typical, they're obeying your commands, you're having them do certain movements, you're directing them, and they're able to follow along with you. 1 being they are not responding to you at all, they're not responding to anything. Think coma, think dead, think sleeping, whatever. They're out of it. And again, if we think of the highest score 6 as normal, the lowest score 1 as bad or coma or dead or whatever, then it leaves us with only 4 numbers to differentiate between. So to start out, we have decerebrate positioning. This is a score of 2. So if they score 2, they present in decerebrate positioning, which is this position here. It's stiff as a board, extension posturing. If they score a 3, they will have decorticate posturing. This involves abnormal flexion rigidity. You can see the flexion here in the upper extremities. So, just as a quick side note, it's important to know the difference between decerebrate and decorticate posturing. So, extension posturing or decerebrate posturing is extension posturing. I remember this because there are so many E's in the word decerebrate. I think E, extension. It also looks like a dead body, like a really stiff person. So this is going to be worse or more severe than this. So if you want to do a deep dive, it's helpful to sometimes view the mechanism in actual person, at least in my opinion. And so you can YouTube this football player. It's a college football player. He gets hit and ultimately gets concussed, and he exhibits this positioning. He's very lucky to have survived this. And so if you want to, it's a little frightening because he does just shoot right into this positioning after going down after a tackle. It's intense, but it helps me remember. And so moving on to decorticate posturing, you can see here there's abnormal flexion rigidity. So decorticate, core, your arms are going to curl towards the core. That's how I remember it. And here you can YouTube another football player. We love sports in my household, so you can YouTube this Miami Dolphins player and see him after he gets hit. He goes down and he goes right into this decorticate positioning where his arms curl up towards his core, his chest, and his face, and he exhibits that abnormal flexion response. So decerebrate is a 2, and then decorticate is a 3. So 2 is obviously worse than 3. So for number 4, it involves a withdrawal response to pain. This, for some reason, reminded me of when your pet or animal is sleeping and you touch their paws. I know when my cats are sleeping, they're just so cute and they often stick their paws out, and I can't help but touch their little toe beans. And they will actually, if you've done that to a pet, they withdraw sometimes their paw, sometimes their whole leg, and not necessarily to say to bring pain upon any animal or living creature, but just as a way to show response or withdrawing from input. And then a score of 5 is similar, but it involves purposeful movement in response to a painful stimuli. And so while 4 was withdrawing from stimuli, it's more so with an unconscious element. So that's why I think of the dog or the cat as asleep when they withdraw their leg. Number 5 has this purposeful or intentional element in response to the pain. This reminded me of when I'm cooking and I grab the handles of a pot after it's been on the stove or burner for a while. It can actually be quite hot, and I will intentionally withdraw my hand as fast as I can to get away from that pain. So the GCS is the sum of the eye, verbal, and motor response score. And so I'm going to color code it here so it can hopefully make a little bit more sense or be easier to memorize. I did green as the top or greatest scores that you could get, green being typical, normal, whatever, and then black being no response. They've gone into the darkness. It's not good. I also color-coded the painful responses as pink for pain. You can see there's 3 here. The yellow responses are like concerning responses, thinking about a traffic light. It's kind of like middle of the road, obviously not good responses, but it's concerning, not good, not necessarily the worst in my opinion. Yellow is just a cause for concern, while red is a extremely concerning presentation. If you think about somebody hitting their head and they come up and you're talking to them and they could speak typically before and now they're incomprehensible, I'd be extremely concerned. I'd be calling an ambulance immediately. Similarly, if they exhibit flexion or extension responses and jet out into those positions, I would also be extremely concerned. We're going to have EMS ASAP. Here is a score interpretation scale that I've created. You can see that greater than 15 points, if you go all the way to the right, is normal. This will be normal brain functioning, while anything from a 13 to 15 can actually be considered a mild brain injury. A 9 to a score of 12 would be considered a moderate brain injury. One way to remember moderate versus mild is lucky number 13. If you get a 13 or more, consider yourself lucky because it's just mild and will hopefully resolve quickly. Moving over to severe, the red highlighted area on the left, that is considered a score of 3 to 8, while anything less than a 3 is considered a vegetable or vegetated state. I know it's a little morbid, but I put a carrot because someone in this score range is going to be vegetable or they're going to be dead. As always, I hope that this was helpful. Good luck in your studies and thanks for watching.